This webinar is about why HIPAA security risk analysis isn't once-a-year thing, and we'll go until about 1 o'clock, and we'll have plenty of time for some questions. I've actually prepared a really long presentation. However, answering this question about why HIPAA security risk analysis isn't once-a-year thing is not going to take all the presentation materials, but I've already got some questions that I hope to get covered. And I'm just waiting for my colleagues to jump on in, and we'll go ahead and get started. First, hi, Sunny. So first, looks like we're here. I'm going to have a quick little poll just to make sure everybody can see or hear me, or both. And go ahead and please go ahead and let me know. Good, very good. So far, loud and clear. Perfect. If you can't hear me, please reach out to us over at E2O Health, and we'll get that hopefully worked out for you, or we can send you the telephone number to call. All right, I'm going to go ahead and close the poll. Looks like the people that are actually here are ready to go. I'm going to go ahead and pass this over to Sunny.
Okay, thank you, Mike. Good afternoon, everyone. My name is Sunny Sharan. Before Mike can get started on his webinar, I just want to kind of put in context as to why we felt this topic was very important for this month's Wednesday webinar. As most of you follow our webinars, we conduct our monthly Wednesday webinars to educate providers on various updates in healthcare, and specifically in healthcare IT. This topic is particularly relevant because the last few weeks and few months, we've seen an increased number of cyber security issues. Recently, a couple of hospitals in Southern California had some ransomware attacks, and they've had to face a lot of fines and scrutiny. And some more audits are coming along the way from OCR, which is the Office of Civil Rights. So there's a whole lot of conversation about HIPAA security, security in general, cyber security. So you'll hear, if you're keeping up with the buzz in the security side, you'll hear the acronyms cyber security, ransomware. You'll hear those words more and more again. So we felt this topic was very important to have a discussion on with the provider community. So Mike's going to be leading the topic in a few minutes. And also another reason why we wanted to have this topic was through our Hipaa Watchdog product, once every quarter, we want to make sure we provide high quality HIPAA security and privacy webinars. So as a part of the education for the members of HIPAA privacy, of our Hipaa Watchdog product. So that's also another reason. If you are a subscriber to our Hipaa Watchdog product, you can attend this webinar. We'll organize them once every quarter. So it'll also check mark your education reminders portion of HIPAA compliance. So that's another reason why we're going to be conducting this HIPAA security webinars. And also, before I let Mike present, I do want to apologize for an inconvenience that we had last week. This webinar was supposed to happen last week, and we had some technical issues, so we had to cancel it, and we had to organize it again this week. So, with that, I'll let Mike take over the presentation. Thank you again, Mike, for leading the presentation today. So Mike will be the host for today's Wednesday webinar. Thank you, Mike, your webinar.
Great. Thank you very much, Sunny. And of course, this is my first role as the presenter here on Webinar Wednesday. I know Sunny and Kelly, as you can see on the picture, so you guys are probably all familiar with them because they run these webinars, and we provide a lot of health education and training as well. I have a really quick poll, just see if you can go ahead. I like to make this a little bit more interactive and know who I'm talking to, and I apologize if I keep looking off the screen. It's because I got the control panel on the right-hand side over here. If I could just get a feel for what kind of organization that you represent, this way, I can maybe tailor the rest of the presentation a little bit more towards your organizational needs. So feel free to go ahead and answer that for me. We'll go ahead and close that poll in a little short bit. As Sunny said, or as you can see on the screen, and Sunny had mentioned real briefly, I am the Director of HIPAA Compliance over here at Hipaa Watchdog. For a lot of you guys that are already Hipaa Watchdog subscribers, obviously you've heard from me before. Maybe you haven't seen me, but you know, you can hopefully you can see kind of get a feel for who we are. Okay, great. So it looks like we have. Let me go ahead and close this poll here. It looks like we have mostly community health centers here, and some other cover entities. We have a little bit of business associates, and we have a bit of a combination. All right, very good. We'll touch upon the business associate section later on in this little presentation here. So we had this quick little announcement that Hipaa Watchdog, we partnered with Veritable to do background checks. Now that's kind of important for your administrative requirements. That's just a little bit of announcement over there. Okay, so
let me just chime in, Mike.
Sure, go.
Expand a little bit on that announcement. One of the things I want to comment on that announcement is if you're a small entity, you probably don't do background checks. If you're a large FQHC or a community health center, you probably do some kind of a background check. Now, Hipaa does not, there are several healthcare requirements that require background checks specifically on any exclusions. If you are taking any Medicare, if you are a Medicare provider or a Medi-Cal provider, you are required to check if a particular provider who works for you or if a particular employee who works for you is in the exclusion list of CMS. So you need to check on that. You could do that by going to the OIG website, or you can actually generally once a year do background checks on all your new employees. So you're kind of checking that box without any concern. So you're required to do background checks. Not just Hipaa, various mandates require you to do that. So there has been an increased request from our side where providers are asking us to say, hey, how can we do background checks? There are several ways of doing background checks. One is your payroll companies do it and all of that. So, but however, we do want to bring that as an option on Hipaa Watchdog. So we partnered with an organization where Hipaa Watchdog does not take a cut, but you have that as a resource once you subscribe to Hipaa Watchdog. So you can sign in, you can sign up for the background check service, and we've negotiated a decent discount for you. So it's like $32 or $33 per background check, depending on the number of background checks you're doing. So you could actually get background checks available, and that'll help you, just maintain a safer workplace for you and your employees and for your patients, and also most importantly meet some of the requirements that you have to meet as a part of being a healthcare organization. So if you have more questions, feel free to reach out to us. I'd be able to answer more of those questions. So we have that option now on Hipaa Watchdog where you can sign up and get your background checks done. So eventually we'll start sending more information via email, but you have that option on Hipaa Watchdog right now. So that's just my announcement as to why, two reasons as to why you have to do background checks, and second is, that availability of that option on Hipaa Watchdog. Mike.
Great, thank you, Sunny. Another quick poll for you. I wanted to see how many of you actually completed an SRA, or at least think that you've completed an SRA. Feel free to go ahead and let me know there. So we have yes, we have no, maybe. If it's yes and you haven't seen it and you can't locate it, it might as well not, We have a few people that said, well, what is an SRA? Maybe we need to, well, I'm going to touch upon that. SRA stands for Security Risk Analysis, and it's one of those requirements for Hipaa. Right? We've all heard of Hipaa. Let me go ahead and close this poll now. Okay, so this is why you need to do a risk analysis in terms of for compliance-wise, right? Hipaa, risk analysis. You got to conduct an accurate and thorough assessment of the potential risks and vulnerabilities on the confidentiality, integrity, and availability of electronic protected health information. So as you can see, this is mostly focused on the electronic part of things, but the healthcare side of things, we still use a lot of paper, right? Good question for you, and you can go ahead. Well, I'm not going to create a poll for this one, but you can go ahead and type in the questions. For those of you that have completed an SRA or have not completed, what are your biggest challenges? Now think about that for a little second. What are your biggest challenges? Well, I'll tell you, in a short, brief little presentation about what the Office of Civil Rights, which are the people that enforce security risk analysis, is that you know, the biggest challenge right now is that people aren't doing it. And so just in our polls alone, we see that about 38% of you guys that are attending right now haven't done a security risk analysis. And you know, this is very important to do. And you know, some of you don't even know what a security risk analysis is. And you know, don't feel like, you know, you're doing a really bad thing. Well, technically, you're not technically in compliance, and we want to make sure that you're in compliance, and that's kind of what we do over here. All right, so the next thing is for you people that said yes, that you did a security risk analysis. What the Office of Civil Rights is doing when they're doing their audits is they're finding out that people are not simply doing the security risk analysis properly. And that's something that I'm going to cover real briefly in the next couple of slides. Looks like you know, we have at least more than half of you that don't know about it or how to do it properly, and we'll go over some of those things as well. And finally, for the ones that have done a security risk analysis, the Office of Civil Rights again said, hey, look, you guys that did it, you guys said you did it, but we don't have any documentation to prove that you're doing it and that you're following through with the findings in the security risk analysis. So those are the biggest challenges right now. This is the most recent information as of January and February from this panel that involved Office of Civil Rights staff and office. My apologies for that. Okay, so top reasons what this presentation is all about, why you need to do and why you should do perform a security risk analysis, right? Number one, compliance with Hipaa, right? Regulatory and industry requirements. You just have to do one. And, you know, it simply has to be done. It's going to be a little painful the first time you do it because there's a lot of things that you did not know that you really needed to do to keep track of. Okay. Next big thing is patient care. We really want to make sure that that all this information that you're storing in these nice EMRs and electronic health records are easily accessible. As we all know, there are patient rights, right? They have right to view their records. They have right to, you know, review them and access to them, and also to send them out to other healthcare providers that might be helping them with their care, right? Another big one for a lot of people, and maybe a lot of people on the line right now, is that we want to avoid the security breaches and security incidents. Every year since I'd say 2011, we've been seeing an increase in security breaches and security incidents, haven't we? You know, there's been some really big ones real lately. We're over here based out of Torrance and Los Angeles County area. You know, we've heard about the Hollywood one and the crypto locker. Those are really big ones. Okay. Now, the fines for those aren't really that huge because there's a limitation in terms of the fines, but look at all the lost cost and productivity. We'll go over that in a little bit more. The other thing is to education. You really want to educate your staff and create a culture of compliance and security and awareness to help bolster your security program. Right. After you've performed security risk analysis, the ones that you guys have done, hopefully you've put together that good security program and put together your security team, because those are some really key things. So the question next is, when do you want to run a security risk analysis, right? It's not just a once-a-year thing. Okay. So a lot of times people run a security risk analysis because they need to do the meaningful use attestation. That is simply one of the requirements that they put there when you're doing the attestation, is that you run a thorough one. Okay. Many, again, pointing back to what the Office of Civil Rights said, a lot of you guys didn't do it, or you're not doing it properly, and you're not documenting and following through, right? But there are some other important reasons why you want to run a security risk analysis, right? If you ran in and you put in a new department that wasn't there before, right? Maybe you added dental, behavioral health. Those departments need to be analyzed as well for any security risks. And of course, we mentioned we added background checks. You know, adding staff is also a risk that also needs to be analyzed to make sure that people are doing the proper things that need to be done. You add a new office, new location. You add new systems. We've seen a number of the clients that we've helped actually change EHRs over the past 2 years. You definitely need to run a security risk analysis about that, about the good and the bad and all the things that need to be mitigated, right? If you have new department heads, okay, I see this a lot, right? We have a complete new department, new IT or leadership comes in. What happens with the old people that were there or that moved on, right? You've got to do a security risk analysis about that as well. You know, what kind of access rights and privileges that they have that now we need to make sure that we close the loop on and make sure that it doesn't come out. I attended one of those cybersecurity risk things webinars, and I've seen some pretty bad cases. One example real recently that was in a $1 billion lawsuit was as a result of one of these department heads actually got laid off, and they decided one drunken night, and they still had access to the systems because it was just that day, they went and accessed remotely on their laptop. I don't know if it was at a bar or something. I only know is that the guy was inebriated, and he went and just merely viewed medical records. Merely viewed medical records, didn't print them out, didn't download them. He just said, hey, let's go ahead and look at them. He did, and of course people found out, and now there's a $1 billion lawsuit against this. Of course he's no longer allowed to practice anymore in the healthcare system. So, you know, that's just a real simple little example of, you know, this about new department heads coming in, new department heads leaving, or old ones. Other things are new software revisions. Every time you have a major software revision, those of us in IT, and you know, I've been IT for a good 2 decades now, these are huge considerations that also need to be analyzed. IT might hold this up on themselves when they're evaluating, making recommendations, but really a real thorough analysis should be done whenever you're changing these new software systems, and also training that might be involved. New hardware additions, right? It's not enough that we have something really cool and up to date that's going to make our lives easier, supposedly, but they need to be evaluated for, you know, the proper use of it. You know, security, software, programs, updated methods, policies, and procedures might all be good and intentionally good, and help us save and be more efficient and help our patients. But if we're not using it properly, security risk, right? Major configuration changes also. Whenever there's a recent data breach, right? How many of you guys out there have actually run a new security risk analysis on the crypto lock? Right, we heard about the Hollywood hospital getting hit with the crypto lock. Did you guys go back there and check and run an analysis about your backup process and a procedure and see, hey, look, if we needed to go back 6 months ago, can you? Or is it completely gone, right? Or recent hacks, right? If you've recently had a breach, very good reason to go ahead and run a security risk analysis. Now, these might just be recommendations here, but actually, once it gets into the hands of auditors and the Office of Civil Rights or the Office of the Inspector General, who also helps to enforce and investigate these things, these are the exact same things they ask you to do. They want to know that you've done one. And if you haven't done one, you needed to do one right away during the investigation. The sooner the better. And the faster the compliance, the better. Okay, so it's not really about whether you've been hacked or not hacked. It's really a matter of when you're going to be hacked. So I often like to point out this little website here called mapped.norsecorp.com, and you can go and check that out in your browser right now. I'll go ahead and open up a separate browser here, and you know, while I do this, let's see if we have any questions. Feel free to type in there comments. Go ahead and type that over there in the control panel as well, and we'll go ahead and try to answer some of those. Okay, so Norse is a security company. They actually went in and they actually advised, you remember the Sony hack and Sony breach, they went ahead and advised Sony about how bad their security was. They really told them straight up it was really bad, and they didn't really have to walk too far in order to figure that out. Norse told them, hey, this is a serious threat from North Korea, or just from anyone who just walks into their offices. And obviously, they really didn't listen. They actually sat on it for a couple of months, and of course the breach happened. We all know what became of that. Cost them hundreds of millions of dollars easily in emails and breaches, and just overall just really bad press for Sony. I don't think they're going to live that one down for a long time. Okay, so here on this map, you can see that Norse Corp actually put together a bunch of the security endpoints throughout the world that actually track and log attacks and where they're coming from, where they're originating from, who they're attacking, what type of attack that they're doing. And this is going on live right now as we're doing this webinar. So you can see it just keeps happening. Okay, so that's the world that we live in today. And I just need you to know that. If there's any takeaway you take from this is that you really need to change your way of thinking and hopefully change the way your organization's thinking. And hopefully then we can help reduce all these security risks that are popping up everywhere. Now, this is a pretty interesting figure. I did some more research, and just a couple years ago when I was doing these presentations over there for CCLAC, Community Clinics of Los Angeles County, the cost of the breach wasn't as high. Right now, take a look at it. The average cost of a data breach is $154 per record. All right, those of you guys that bought cybersecurity insurance, see how much that costs. And I often get the question, well, Mike, how much is cybersecurity insurance? Well, right now, it seems that the industry standard right now is about $10,000 US per year per million, okay, in terms of coverage. Now, here's the shocker, is that for healthcare, according to IBM, they said it is now up at $363 per record. That's the cost, right? Why is it so high? Well, there's a lot of information in there. The information there is extremely valuable to these hackers, these people that like to sell this information for insurance fraud, just credit applications, things like that. This is easily the most regulated and industry out of all of them. Right, $363 a record. Just go ahead and do this quick little calculation in terms of whether or not you needed to do a security risk analysis. How many records do you have in your systems that you are responsible for in your organization? Multiply that by $363 per record. And you'll have a pretty good idea of just how much cybersecurity insurance coverage that you might want to get every year for your organization. And if you do a security risk analysis, obviously we'll get in a little bit more details about, well, you know, maybe we don't need as much because we did an analysis and we figured, well, maybe we should spend the money here and not there, right? So the whole goal, in my opinion, of the security risk analysis is to create a culture of compliance. This can't be just a once-a-year thing. Like, oh, it's 2016, we got to do this again. It has to be ongoing, right? This is really costly and it's really bad for patient care. Okay, so we have HIPAA events. This is what we often recommend. And, you know, actually run a quick little poll here. Give me a little bit of a breather here. So after we've talked about this and we've evaluated this stuff, this little poll I maybe could have ran a little bit earlier, but does your organization have a complete and thorough security risk analysis? Now, keep in mind, the thorough security risk analysis covers at least 3 major areas, right? We got the physical safeguards, technical safeguards, physical safeguards, we got administrative safeguards, and we got the policies and procedures, right? And it's even better if you have a copy in front of it, you can easily have access to it. I believe that, you know, if you're part of this, this webinar, you would be able to easily get that information. All right, okay, so looks like we still have a few more people answering. Okay, good, looks like a lot of you guys have it and that you'll go ahead and get it. I recommend you get it. And, you know, another thing that you know, I know that I would do for you guys is if you want us to go ahead and do a quick audit of what your last security risk analysis was like and give you some feedback, you know, we'd be happy to do that. Yeah, free of charge. Okay, so I'm going to go ahead and close this poll right now. Looks like, ooh, 14% of you have a copy in front of you. That's very good. Very good. So the big challenge last year for a lot of people who were doing for you, those of you that haven't done a security risk analysis, one of the big headaches is, of course, doing the policies and procedures. That is a big headache. There's a lot involved, and in HIPAA Watchdog, we actually provide really good policies and procedures that you can work with, you know, some of the best practices. So that's one of the things that will help you save easily hundreds of hours right away. And yeah, it is partly template based, but obviously we go over that with you, and you know, there's obviously some things that don't work with your organization, and it's important to not just adopt something that's just run-of-the-mill. We want to customize and tailor to you. Okay.
So, Mike, did you answer the question from Mika?
Oh, no, please, Mika, what's Mika's question? Sorry, go right ahead.
Like, would the ransomware be considered a breach if the ransomware, you know, blocked a clinic from accessing the information? However, hackers don't have access to it. Would it still be considered a breach?
Right. Okay, that's a very good question. And I'm really glad someone asked that. I actually put together a whole huge presentation on that. But real briefly, no. Right now, the current iteration of CryptoLock does not actually breach out the information out. But it's not because they can't. They could if they wanted to. It's just less risky. And they're sending out these attacks out everywhere just through these bot systems that just go ahead and try to do the phishing attack. So this stuff remains encrypted. No, they don't technically have access to that, but actually a more thorough investigation might have to be in place, because while they're encrypting it, they could also be sending out tidbits of information here and there, particularly if your information is not encrypted and is in plain text. Okay, so right now they're not, but in the future this stuff is always evolving, right? The latest version of cryptoware is actually unhackable within our lifetimes, and I have more slides about that. Meaning that once you get it, if you don't have a plan to restore, you don't have that policy and procedure to get all this stuff back, and you don't have your processes down, you didn't do the full security risk analysis on that, you're simply going to pay the ransom. And actually, there's been a lot in the news that the FBI says, hey, look, if you got this CryptoLock and you don't have any backup, honestly, just pay the ransom. That's one of the only options that you have left. Okay, so that doesn't necessarily constitute a breach, but a more thorough investigation will be required. So the Office of Civil Rights will say, hey, look, we're going to investigate. You're going to call the FBI. FBI is going to come in and investigate. They're going to see, and they're going to want to look at your server logs to see what information actually got sent out. So luckily right now, they're just encrypting it and just locking it so that nobody can access it, even themselves. They could technically unlock it and send it out. But honestly, after you get hit with it, your IT is going to remove the crypto lock and put you in anti-malware and safe. So it wouldn't constitute a breach. No, but great question.
So Mika, if you'd like to take this offline, happy to talk you through this. And in fact, if you're facing a situation with ransomware, happy to work with you confidentially to make sure we address that issue. So reach out to us separately if you have any questions or more concerns on ransomware.
Great, thanks, great question. Okay, so how do we create a culture of compliance? Going to this is that we recommend having HIPAA events all year round. This is actually one of those things, one of those questions, like do you do security alerts, you know, regularly to let staff know, to let your business associates agreements know, have these regular trainings, have the HIPAA training. Have these security alerts when something happens, or if someone notices something, or just something in the news. This helps to create a culture of compliance. Review that disaster recovery plan and actually set aside some time during whatever downtime that you might have. If you don't have any downtime, maybe you might have to schedule something on the weekend where you go ahead and test to see if this disaster recovery plan helps. So for instance, someone is asking just recently about the cryptoware, right? That do a pretend event where suddenly you don't have access to the data. What are the first things you need to do, right? Make sure everyone on staff knows what to do. Those few moments actually, when someone gets infected, could mean the difference between saving all your data or losing it all and then being next on the news. Okay. I created actually a pretty long video. It's 30-some minutes on that where I show you exactly kind of what happens when you get hit with crypto. It happens in a blink of an eye, okay? And you just have to know and see what the signs are. That could be very valuable training for your organization, for instance. So that's something that could be something that you schedule in. And this is great because you want to document these things because when you have an audit and you want to prove that you guys are doing the best, it's all about the intentions here with a security risk analysis. If your intention is just hey, let's just do it once a year. Let's do it again next year. And they found out that you haven't made any adjustments or changes to reduce these risks, obviously they're going to inspect further and the fines are going to be a lot more, right? Okay, so trainings. We touched a little bit about trainings. These are some of these recommended things. We unfortunately had to help some organizations that were already going through an audit due to some breaches and some other personnel issues. So one of the administrative requirements, of course, is to do trainings. And obviously the background checks are highly recommended. They're not required, but they're highly recommended. And as a result of this stuff, you know, we have a series of questions that you go ahead and answer in Hipaa Watchdog. And those of you guys that are in security risk analysis know that there are required sections, right? No matter what you got to do to be in compliance. And then there's the addressable ones. The addressable doesn't mean that you don't do it. All right, it means that you gave it some really good thought, you had some intention, you ran an analysis to figure out, well, look, perhaps we can't afford it, perhaps we don't have the resources for it, and we can't do it to the best of the practices are available, but given the resources that we have available, and this is our analysis, it's a low-risk item, this is what we're doing instead, right? But the Hipaa trainings, you really can't get around. You really want to do it, and you definitely got to do it, and do it annually. And in Hipaa Watchdog, we make that easy for you. You track it and send out the trainings, give you certificates, make sure it's documented that you know what was covered in the training, right? Other reasons, you train when there's a change in the law, right? So business associates are being targeted now, making sure that you have the business associate agreements. That change law happened years ago, actually. I believe in 2012, the omnibus thing where now the business associates had to be covered, make sure that they're also trained and all that stuff. So obviously that's a good reason to train, right? When there's law change or policy change, right? Train is part of Hipaa sanctions. Okay, when I go do an on-site, just an audit when I'm asked to do it, and you know, I ask, well, hey, look, have you had any issues with Hipaa stuff? And if I don't hear anything, that's a red flag. Okay, that's me personally. I feel that Office of Civil Rights, when they come do the audits and they find out, hey, you mean throughout the course of the whole year you haven't noticed any possible Hipaa violations? That's very suspicious. Okay, so you want to document those and also make sure that training is a part of the plan when you're giving out these sanctions, okay, to employees, right? We do this, sometimes it's a mistake, it happens, and it's just very strange when none of it's documented, particularly if you're being investigated for breach. All right, individual states have different regulations on when Hipaa training has to be done before access to EPHI is granted. I believe here in California, it's within 7 days, so you know, if you have someone, the intern coming in here, or if you have someone who does not have a documented recent Hipaa training within the past year, just go ahead and get it done. Again, in Hipaa Watchdog, we make it real easy for you to track that stuff. Train on the high-risk threats. You know, what's being hit by the organizations around you, within your vicinity, or just medical stuff, right? Also, make sure you document everything. You're going to see a constant thing in a lot of my presentations where I tell you document, document, document. And that is one of the great things about having Hipaa Watchdog, which is what we do, is that we provide a dashboard for you to document and keep track of this stuff. If you didn't document it, it didn't happen. So for those of you guys that actually said, yes, I have a recent copy in front of me, great. That means you have this documentation, right? That proves that you have done a security risk analysis. Whether or not it's thorough enough remains to be seen. Yes, I will go get it. Hopefully you guys went and got it and you have the document in front of you, even if it's a virtual PDF document. That's fine. For those of you, the third of you that said yes, but it's a few years old, well, it's definitely time to do a more thorough one. Because chances are there's been a lot of changes that has happened over the past few years that you want to make sure is updated. You know, and lately the business associates agreements and all that stuff have been in the news. All right, any questions? Feel free to type in. I hope this information is useful to you, but feel free to ask more questions. Let's see, any questions? Any questions? Okay, no. All right, so here's some examples of security alerts that you want to do. And again, this goes in with the theme of why Hipaa security SRAs are not just a once-a-year thing, because you actually have to do these things throughout the year. All right, security alerts. When you have password policies, policies and procedures, any changes about it, people that are possibly sharing passwords. I often have to dog down on my colleagues in the medical field about using the same password in places. Just don't do it. Okay, make that part of your alert. Don't use your password anywhere else. All right, if you're using it one for EHR, don't make it the same one as the Windows login. Don't make it the same one as your email. Okay. Security alert about sending EPHI via email and encryption. Okay, that's an important one. I know for a fact that over the past few years, a lot of people have been sending EPHI through email, and that's not encrypted. That's just the truth. It's a bad idea, particularly since the stuff remains on the email servers for a while. And as we all know from the Sony breach, a lot of the information got breached because this stuff remained on the server for a long time. Right? We got these mailboxes that are huge now. Right? I think Google gives me 10 gigabytes of email storage. 10 gigabytes. That ranges all the way back to the last 10, 15 years of everything that I've ever done. It's all out there. Right? Luckily, I don't have EPHI in there, but are you confident that you don't have that? Make sure you run through that scrub and figure out what your policy on this stuff is. Work that out with IT. CryptoLocker information and warnings is a really good security alert to have been giving out this year. So if you haven't done that, I recommend doing that now or soon. Okay. I will go a little bit more about that because that was most recently in use. Social engineered hacking warnings. Okay, I'm gonna have 2 more slides. We're talking about this social engineered hacking. Yes.
Another question from Mika.
Question, great.
Another question from Mika.
Yes.
I think sometimes consultants can be considered as BA or part of workforce. Mm-hmm. My understanding is that if you are BA, covered entity doesn't have to train them, but should expect them they're trained. As part of workforce, we need to provide the training. So let me take the question. Mika?
Okay.
So yes, you're right. You know, the question is, you're right. If covered entity has to train their employees. Now, business associates, if you have a business associate agreement signed with them, then they're responsible for their own security and their employees' security. Like, business associates can be several kinds. The most common question we get is, hey, I work with a hospital. Is a hospital a business associate? No, hospital is not a business associate. They're a covered entity. They say, I refer my patients to another provider. Is that provider considered a business associate? No, that's not. So a business associate is someone like an IT services company, for example, a shredding company, for example, an outsourced billing company, a revenue cycle management company, for example, or a copier and company, for example. A business associate is someone who's not a covered entity and who does a particular service for you. Now, there are other questions that come up most commonly is, I use temp workers to work in my practice. Now, are they business associates? Or I use temporary doctors, contract or per diem doctors who come and work for me. Are they considered business associates? Now, that is where the trick comes in. If you are employing providers who are from a temp agency or a locum provided from a locum agency, then that agency is supposed to train them. But they are seeing your patient medical records. So that's a gray area, and I'd say you might as well train those providers even though they are temp employees. Then there's another question is, you're hiring a temporary provider who's not on your W-2, but he's a provider who works, you pay them hourly or however your thing, they're a contractor to you, you 1099 them. Now, are they a business associate or an employee? Now that is where then you may treat them as an employee and get them Hipaa trained. So my answer to Mika's question is, if it's a provider or any staff who sees your patient and they're not part of a large agency who trains them, then you might as well train them yourself. If they're just a consultant who comes and sees your patient and leaves, and he or she does not work anywhere else or works only at 2 or 3 other practices, then check with them if they've taken their Hipaa training and all of that. But at least have a business associate agreement. You need to have a business associate agreement. and some kind of a document that protects your patients and your organization from any breaches caused by that particular business associate. If you're using an IT services company, agency that's not a covered entity, then having a business associate agreement is enough. You don't have to train their staff. They will do. They're supposed to do it. I assume they do it. So that's the answer. I hope that answer helps you, Mika. And another thing I do want to do is, I'm not sure if you're a subscriber to Hipaa Watchdog or not. In Hipaa Watchdog, we do keep track of all your BAAs. Make sure you can send out customized business associate agreements from Hipaa Watchdog. Once you list down your vendors, you can send customized BAAs and then get their signatures and have them stored on the server for you, so you don't have to worry about that. So there's an option for you. So if you're a subscriber of Hipaa Watchdog, you can use that BAA feature on Hipaa Watchdog. So that's just an FYI. So, and Mike has it open on screen. Also, Mike, most of the times the common question we get asked is, hey, who's a business associate and who's not? Mike, if you click on that BAA tree, so we kind of identify who's a business associate and who's not a business associate. It's important to know that. If you go through this checklist, you'll find out there are only a certain types of organizations fall under the business associates, and then you focus on those organizations. With that, Mike, you can X out of that PA screen. And then here, once you specify who's your business associate, you can actually use this to send business email BAA to your vendor and upload any signed old BAAs, and you can see a log of all the previously signed BAAs on Hipaa Watchdog. So that's a feature that's available to you. But again, make sure you get your BAAs and definitely train your staff and contract providers and contract nurses. If they're part of a larger organization, then hopefully they'll take care of them. But at least, nevertheless, with every business associate, have a BAA agreement with them. Thank you, Mike.
Thank you. I hope that answers your question. And I jumped a little bit over to this North Memorial Healthcare of Minnesota and a resolution agreement. And this is this just happened recently in terms of the findings. Okay, but this was an investigation of something that happened way back in 2011. So obviously they're being fined for it, right? As you can read on here, that there was a business associate that had a locked vehicle and they put the laptop in there, and the laptop was not encrypted. I'm sure it was password protected, but it's not encrypted. And frankly, back in 2011, a lot of people were not encrypting their laptops, and that was just a common thing. Still, they're in trouble for it, right? It impacted 9,497 individuals. Those are all those records. And they failed to have the business associate agreement. So the Office of Civil Rights will fine them, right, for not having the BAA. So that's that thing, right? But separately, there could be a civil lawsuit, or there could be other lawsuits from these individuals who just said, hey, look, you breached my information. So they could be really liable for that. So the BAA agreement kind of protects you and also helps to set that standard with the business associates that they need to be doing what they need to be doing to protect this stuff, right? But on the flip side of that, the stuff for the 9,497 individuals, the cost for that could be a lot more. That's why the cost of the breaches is so high, because then you might have to provide credit monitoring, which runs $100 per person for a period of 5 years, which is what was pretty standard for people who had their information stolen. That was required. If let's look at the Anthem example. That's how much they had to pay. That number's close to $1 trillion, right? So having a BAA is important for that compliance portion, but you have to ask yourself, how strong is this BAA? So make sure that the BAA agreement is up to date, and we provide an up-to-date one. But also do your due diligence. It's intentional. Someone who doesn't look like they went through that training, you might want to ask more questions and find out more. Make sure that that organization does background checks. Make sure this person's valid and legit, and they're not looking out for either themselves or to raise money or steal these records. Because ultimately, you are also responsible, as well as the business associate, as well as the individual, should a breach happen. Okay. Now, okay, going back to security alerts, we're running out of time, so I'm gonna skip through some of this stuff. Disaster recovery is also a really important one to do, particularly with the CryptoLock threat, right? You got to run the drills. You actually have to test recovery plans. Here's the thing. A lot of you guys might have set up new policies and procedures for disaster recovery, but how many of you guys have actually tested and run through, make sure that actually works? Right, when you do that, you might find some examples of where there are definitely some security risks and some things that need to be adjusted and customized. Don't just take, for instance, in Hipaa Watchdog, we have a nice, great disaster recovery plan. Don't just take that for what it is that you guys were doing. It's no good if you have policies and procedures that don't fit in actually what you guys end up doing. That's just bad. All right, always test it, verify, trust and verify, and document everything. Even when you're doing these disaster recovery testings or trainings, have that documented. Ask IT to document this. Put this all together in a folder. Document this stuff inside Hipaa Watchdog. I think a lot of challenges that people have been doing with SRA is they have that one report, but then they don't update it. And that's the key. You have to document and update it somewhere. We keep the central repository for you guys to go ahead and do that so that it's ready to go. It's audit ready. And I'm going to go over real briefly. Well, I don't know if we have that much time left. Let me see. It's 1 o'clock right now. Do we have any other questions? I figured in a couple minutes I can go over real briefly how the SRA is done, because some of you guys haven't, but you guys can reach out to us. Actually, reach out to Kelly. She can get you started. The whole thing is about intent, making sure that you're intending to do the SRA and that you're following through with it. I have a lot of other slides about the other things we get at SRAs, but we are running out of time. So any last minute questions here? Feel free to go ahead and type that in there. Or if you want to see something left in the presentation, I should also mention that in Hipaa Watchdog, we actually provide videos. We have a whole YouTube channel. And if you want to know a little bit more about the CryptoLock thing and see that example of how that is, you can check us out on Hipaa Watchdog on YouTube, and you will see that we have videos on there. I even show you how to do encryption on your computer systems. Right? I actually show it to you live on how you can enable encryption for your laptop, should any laptops be used, and it's recommended that you do all over it. So right here is the Hipaa Watchdog crypto ransomware. You actually don't need to be a subscriber to see these, but because we provide health education and training for the community, so you can go ahead and check those out. Any other questions? Hopefully I answered the question about why security risk analysis is not just the once a year thing. You have all these things going on, and you really want to create that culture. And in order to do that, you actually have to do it. And when you document it, you prove that you have developed that culture of the compliance, of reducing the security risks and protecting this important data. And I put a monetary figure on that at $363, $365 according to an IBM study about how much these breaches cost for healthcare. But if you just look at every single sheet of paper, every single record, that is actual cash, and if it's sitting out in the open, someone could take it, and then you'd be liable for it. And we don't want to see that happen, right? So the first step, of course, is actually to do the planning, acting upon it, and checking it. One other important note that I want to point out is that the Office of Civil Rights, as you can see, they're only catching up on a lot of these cases in 2011. Right, 2011, with that breach I just told you about how that business associate had that laptop stolen from his lot car with a password protection on it, but it wasn't encrypted. So, that's as good as nothing. You take out the hard drive, plug it into another one, now you have all the stuff. All right, so the Office of Civil Rights are now actively going out to do these audits. In 2015, they were saying that about 10% of all covered entities are being audited and only 5% of all business associates. In 2016, the budget has been increased quite a bit. So they're focusing on the business associate agreements. I've heard from an attorney that they are actually sending out people disguised to your locations to see if they can glean information or to see just how secure you guys are. If you're following through on policies and procedures, if they can just walk past the front desk and access or touch someone's computer. For those of you guys that are IT focused or know a little bit more about IT, you'll know that if you have physical access to a computer system, just by standing in front of it, access to USB ports, your data is as good as stolen, right? It's just that quick. particularly with this technology and with high-speed internet access. Just a little bit of background on Office of Civil Rights Investigations. They've only resolved 24,000 cases so far, and they have a huge backlog they're still working on, but they're working on it. And we want to keep you out of this whole data breaches affecting 500 more individuals. That's really bad. All right, the most investigated by the Office of Civil Rights are the following: impermissible use and disclosures of protected health information. That's an important part for the training and also your policy and procedures. Lack of safeguards protecting health information. Lack of patient access to the protected health information. So you remember we talked about the crypto lock real briefly about, well, that doesn't constitute a breach, right? But look at all these patients that didn't have access to their PHI. Okay, that's obviously an investigation. There's going to be additional fines for the Hollywood if the news headline announcement was not enough, the patients leaving because they couldn't get access to their health care and, you know, couldn't get health care, right, throughout the whole period of a month. You couldn't get it. Lack of administrative safeguards. These are all very important. Make sure they're up to date. Use of disclosure more than a minimum necessary of protected health information. So they're coming out to check on this stuff. So they don't necessarily send you an announcement before they come and do an audit they just send someone out and they say, hey, I'm the cable guy, or hey, I'm here to check on maybe your power lines. They could be investigating you. And then I have a little bit more about some breaches. But we are definitely over time. I thought I'd give you a little bit more time to see if you have any other questions. And Sunny, Kelly, do we have any other questions?
No, I think I don't see any questions. Mike, thank you. And I just want to reiterate the fact that you know, there's a lot of videos that Mike records. Mike, you can actually go to those videos section. You know, you could utilize that. And also on Hipaa Watchdog, we provide thorough policies and procedures, privacy and security. So if you never had any policies and procedures, or if you'd like to update what you'd built before, you could use those policies and procedures. We want to make sure you're compliant on Hipaa. So anytime any subscriber of Hipaa Watchdog, if you're going through any audit, we're there as a resource for you. And these audits can be meaningful use audits, CMS audits, medical audits, OCR audits. So reach out to us. We'd love to make sure that we assist you with those audits. So we're there as a resource. If you're a subscriber to Hipaa Watchdog, please reach out to us. Or if you're a subscriber to any of our other services, anytime you have an audit, you know we're there to support you. So reach out to us. But let's avoid an audit and let's make sure that you're compliant. Mike used the word culture of compliance. I think that's what we want to impart through these webinars and through our services. So that's all, Mike. That's all I had to say. And
great, thank you, Sunny.
And we look forward to, sorry, one more thing. Look forward to our next month's Wednesday webinar, where we'll talk about some of the new incentive programs that are coming up for the Medicare community. It's called merit-based incentive program, and you know, how meaningful use is transitioning, and we'll talk about that in the next upcoming webinars. Also, another thing as a disclaimer, if you haven't signed up for the Hipaa, for the subsidized services, we are enrolling. We have 200 slots open for free subsidized meaningful use support services for the next 2 or 3 years. So you can sign up. All you have to do is just send an email and we'll just qualify. And if you're qualified, we can sign you up to any one of the 3 programs we're assisting. We're still enrolling 300 providers. It's for primary care providers and also specialists. So thank you. Thank you all. Have a good afternoon.
Thank you, everyone. And here's Kelly's contact information. This is how you can contact her if you want to get started, try out her services. You know, I think they're affordable. So check it out. There's her email, her cell phone, and the office line. Just give her a call. Tell her you want to get started on this, and we'll get you rolling. Thanks, everyone, and have a great rest of your week.